The abdominal muscle has a right side and a left side. The abdominal muscle stretches during pregnancy, and the connective tissue between the two sides makes it possible for that muscle to get stretched all the way and then come back to its original position. Sometimes, after having the baby, the muscle fails to heal completely and it continues to have a gap between the two sides. That's called a split in the abdominal muscle or diastasis rectus. We're going to go over a very simple way to measure and see if your abdominal muscle has healed after birth or does it still continue to have a little bit of a separation. For this, you're going to lie down on your back with your knees bent, preferably on a surface that is firm. Laying on your back, you're going to take 3 fingers of any hand you want and make them very stiff. Don't allow your fingers to bend. Keep your fingers very stiff. Find your belly button and put the fingers vertically into your belly towards the spine. Don't be afraid to use a little pressure to push through the belly. If you had a baby less than a week ago, don't try to do this. Try to wait at least a month or 2 months after giving birth. Put the fingers in your belly button all the way to the spine. Find something on the ceiling to look at and keep staring at that spot as you lift your head, neck, shoulders, and bra strap off the ground. See what your fingers are feeling and repeat if you need to. Avoid looking at your belly. That uses your neck muscles. That's why it's important that you look at the ceiling and keep the distance between your chin and your chest. Once you're up in that position, measure, is my finger sinking in or is it getting pushed out? The abdominal muscle has a right and a left side. As we perform this little abdominal crunch, the sides come together and close the gap and should push our fingers out. If there is a gap, you will notice that the finger sinks inside that gap. What you want to measure is how wide is that gap. Can I fit my 3 fingers or is it 2 fingers? Is it 1 finger wide? And how deep is the gap? Is it 1 knuckle deep, not even, or more than that? Just measure how wide, how deep. And what do I feel? Does it feel like a mushy tissue that I can push through? Or does it feel like a strong, tensed connective tissue? If you have a gap more than 2 fingers wide, it is considered as a diagnosis of diastasis rectus abdominis. If you have a gap that is less than 2 fingers, it is not considered as a diagnosis of diastasis. While it's important to pay attention to how wide that gap is, it is more important to know how deep that gap is. The connective tissue between the muscles has the ability to heal and become strong. The tissue that you felt at the tip of your finger, if that felt firm and strong, that is better than a tissue that feels like it does not create any tension. If you have established a diagnosis of diastasis rectus abdominis and want to know what to do about it, reach out to a physical therapist that specializes in providing care for peripartum women.